So in general, as I mentioned before, so over the last 40 years, we have made tremendous progress, not only in the way that we diagnose multiple sclerosis, but also in the medications that we have for multiple sclerosis. The idea is that we need to recognize that in the world, there are about 3 million people with multiple sclerosis. The statistics are very, very, very impressive because 1 million lives in the United States and Canada. The other million lives in Europe, right? And then the rest of the patients, about 1 million, probably 700,000 to 1 million, they don't have access to care. And they don't have access to the same medications that you can have if you're in Europe or you're in the United States. So that's problem one. If you go to the United States, right, we have 1 million patients with multiple sclerosis. And probably 30% of those patients are Hispanics or African Americans, again, with problems of access. So if you put all these together, we realize that a significant amount of patients with MS, they don't have access to care, the right medication, and the right time. So one important concept that we learned from a stroke is that there is brain is time, or time is brain, right? In the MS, it's kind of the same, because obviously we don't see the amount of significant changes like in the stroke, but the end process of the accumulation of lesions over time in multiple sclerosis, it leads to dementia and leads to disability, and that is impactful. If you have, lesions that are very, severe, localized in the spinal cord or deep in the brain, we know that African American and Hispanics, they have predilections for lesions in different areas of the brain that they actually suggest or signify more disability than others. So the idea is that we need to realize, and we are realizing that through the work that many are doing in both in the United States and in the world, that those patients with multiple sclerosis that are not being diagnosed or they have delay in treatment, that's something that we need to actually tackle. And this is significant. So one of the most important things, one important message for the general neurology audience is that if your patient has visible symptoms, think MS. Right? There is a confusion in the general neurology population, either in family medicine and internal medicine, of what are the real flags, red flags in MS. And those are compiled by the so-called clinical associated syndrome. So visible is all about these clinical associated syndromes warning signs. If your patient has the right age, is a minority, and has any neurological symptoms that evolves over 24 hours and stayed over 24 hours in the absence of infection, inflammation, in the flu, COVID, you have to think MS. You have to think multiple sclerosis. So we think that the impact that we can have by increasing awareness is going to be significant.